Hi, good morning, everybody. Thank you very much for joining me again for our weekly webinar. It was so nice to actually see many of you guys in the sense that seeing you guys on Facebook and live and also in Zoom webinar was really cool in the sense that we can see all of you. Actually, let me share with you why I want to talk about pre-diabetic. Because I have now have many pre-diabetic patients who said, "Hey, how do I prevent pre-diabetic?" And I have been told by my doctor that now I'm pre-diabetic. Uh, what kind of food should I not to eat? And so, this is a real issue for many individuals who are actually newly become a diabetes patient or pre-diabetic patient, or not really a now being sick yet, and they don't feel much about why I have to do something. And give you a good example is one of my client who maybe about almost a year ago he came to see me and say, "Hey, my doctor's saying that I'm already a pre-diabetic." And during this time, this client of mine is really not sure what need to be done. The doctor said you have no medication, you got to change your lifestyle, you have to decrease your diet intake with a lot of sweet food. So in their mind is okay. I'm not eating a lot of sweet food already, but my blood sugar continue goes up. And when she saw when the client see me at that time already, the blood A1C already got down to 6.3. And on the other hand, there's no change of habits or anything like that. Eventually, very quickly, within 4 or 5 months, they went up to about 6.57 range already. So she's concerned, and the clients are concerned, and then so I help them with Lowsutea, and that result is start bring the blood sugar A1C back down to below 6.4. Now, however, during this change is very interesting. It's very dynamic now because during the change, we have start saying that, hey, it's not only drinking Lowsutea, but you have to change your lifestyle. What's that mean? And the client really have no idea what that means. So what we started off is like, look, we have to start doing exercise. And that is something that is not easy for a client to change because they have no concept of working with exercise before, or they think of, really, do I need to exercise? My age is now 50 something years old, and how can I do exercise? So I said, just walk, go to a shopping mall and start doing that. And also start doing a regime or lower her weight, the client weight. So net result, all these things are coming slowly changing by weight control, diet control, and then monitor blood sugar, monitor weight, and recording everything in, and you see the trend. But surprisingly, after a little while, they start thinking, wow, things are really changed because the client feel much better, healthier, and also think that, wow, I can really do something that to change my whole well-being. And realizing the disease process, now I will not be getting diabetes because of the fact that now my A1C continue going down. So all that are continue to change the lifestyle and take almost 6 to 8 months before you can get it sunk in. So net result, it really works. So what I'm trying to do is saying that, hey, diet is just one thing, but that's something that you got to do, but it will be very good for you. And changing lifestyle is also very good for you for pre-diabetic prevention, for you to get converted to actual diabetes. So let's start with our webinar today. And I think it will be really interesting to actually learn about, okay, what food and why you have to do this. So you get a really good idea, things are what you need to do. So we're going to start our webinar. And it will be a very good webinar for you to better understand what you have to really to get yourself prevention from your diet to pre-diabetic, in diet management, what food to prevent, and other things you got to do to help you to really move on to this lifestyle changes and continue become a healthy person. And you'll be really healthy for many, many years to come and not getting to diabetic complication. So today is our webinar. Now, what we're going to do is talk about, okay, what is pre-diabetic? What's the risk factor? Why food impact your blood sugar? And then what list of food you should avoid. I will give you a list. You can take a picture. And what is the healthy alternative that you can able to do in your diet? And then some of the practical tips to manage your pre-diabetic through the diet. And maybe also add on your exercise and weight control. And how can Lowsutea help? And basically today, that's our webinar is going to be. Now, everybody, by the way, will go through fourth stage of your webinar, fourth stage of your sort of your diabetic changes. The first stage is your LDL cholesterol goes up. And when your LDL cholesterol goes up, you know what? It hurts your B cells from the pancreas, called B cells. And when that happens, the sugar are staying in the bloodstream, not going to the cell, because the B cells take the sugar into the cells. So net result, the problem will come because the blood cholesterol add on your LDL cholesterol, add on sugar, the blood become thick and start forming plaque. So very quickly will form, go to stage 2. The plaque will form, and net result, you're going to get plaques all the west vessels, and diabetic is the real major issue, because if you form all these plaques, and then your blood vessels is going to be all plugged up. And as time goes on, in 10 years, your complications are all coming because of the fact that it just plugged all your vessels. And then very quickly, you probably move to stage 3. And when in stage 3, your blood sugar continue goes up, and every doctor will measure the same thing and measure your blood item called HbA1c, which is a hemoglobin molecule, which end up with a percentage sugar who attach this hemoglobin. So if you're 5.7, you're a normal person, but you're over 5.7 to 6 and 4, now you're a pre-diabetic. Unfortunately, during pre-diabetic stage, you know what? You have no medication. Doctor will come in and tell you, hey, you're pre-diabetic. You need to start watch out your diet and change your lifestyle. But not well explained. So majority patients have no idea what to do. On top of that, then not much motivation what to do. So they would keep the same lifestyle. So your A1C would just continue to go up and go up and go up. Eventually, very quickly, in about 3 to 4 years, you will be converted to diabetic. Now, once you convert diabetic, you can come back. So you got to prevent yourself to convert to be a diabetic. That's why we now help a lot of patients that even before they get a pre-diabetic, if their cholesterol goes up and sugar slightly goes up, we start working with them, get them to understand so they will never get down to pre-diabetic state. Isn't that wonderful? So you don't want to get yourself being sick before you treat it. You got to get yourself, prevent you being sick. Now, even though you're even though if you're diabetic, you can also convert back to pre-diabetic stage, and we will show you how. And a lot of my patients really can able to do that. I see in my own eye, a lot of patients that they're high at 10, they went down to 6, as A1C being 6 and 6 below. Isn't that wonderful? So those are wonderful news for many of my clients that because all the things they do, not only drinking Lowsutea, but also changing lifestyle, exercise, weight control, and also, able to measure the blood sugar to continue to monitor and basically with the diet control, everything. So they changed entire lifestyle, then the A1C will continue to go down below 6 and they become super healthy. Okay, now, why you drink Lowsutea? Well, Lowsutea is very simple. There are only 2 ingredients. There's one called guava leaves, and bitter melons and guava leaves. Now, guava leaves basically have blocked the sugar going to the cells, so going to the gut vessels. So you have less sugar in the gut vessels, so less sugar go back to the cells. And bitter melon is actually increase the insulin sensitivity, taking sugar into the cells, and also excess sugar, cholesterol, and sodium will dump out through urine. So result, you will lower your blood sugar, cholesterol, blood. When your sodium go down, your blood pressure will go down, and plus detox. And a lot of people will drink this. They said that, hey, besides that, I also start losing some weight. Correct, because you have a lot of diuretic, get rid of the fluid, and get rid of sugar. So your blood sugar will go down, cholesterol will go down, your 3 high basic will go down. And that result also your weight will start also going down. Now, we don't only ask you to drink Lowsutea itself, because that's just one item you have to do. But you also teach you about low carb diet, low fat diet. You have to exercise, you have to control your weight, move your BMI lower than to 23. If you're 30, we'll help you lower to 23. You can hear our weekly free webinar every week. We'll give you idea how to help you control your blood sugar and lower your blood sugar. And then also you can track your blood sugar, your weight, your exercise. We give you all that method here to do that. So it's really exciting. And we see a lot of people, even A1C as high as 10%, they drop it down to 5.7. Isn't that wonderful? And so that's what we're trying to do here. So now let's talk about what is pre-diabetic. So you get to know what is the effects of pre-diabetic and why you need to do something about now, not when you become diabetes. First of all, in US, 1 in 3 people basically are pre-diabetic. Now, that's a lot of people, okay? Let's talk about 96 million people in America are pre-diabetic. And this is something that you got to ask yourself, wow, if all these pre-diabetic, eventually, if I don't do anything, I would just stay in the same lifestyle, I will convert to diabetes, and that will be horrible. That will be terrible, because you will really affect your health. And many problems, many Americans don't even know they're pre-diabetic. They don't have idea. Matter of fact, they usually caught themselves in surprise, find out, oh, I'm pre-diabetic, either through the regular health checks or because when they start looking at things with the doctor, they're obese, whatever issue, they will start looking at it. And so they start identifying, so, oh, I'm pre-diabetic, which means they will measure the A1C. And the A1C is beyond 5.7 to 6.4 range, they are pre-diabetic, okay? So also 30% unless a young adult now also become diabetic because of the diet, and they don't overweight and whatever. So really at the end of the day, pre-diabetic is actually a lot of issue, not only in the United States, but also worldwide. And same thing in Asia, in many of the countries are the same issue are facing. Now, when you're pre-diabetic, basically how it works is, 1, if you're a normal person, your A1C should be about 5.7, okay? Now, if you're pre-diabetic, A1C will become 5.76. And I mentioned, what is A1C? Your hemoglobin, percent of sugar attached to this hemoglobin cells, and then you will consider, if you're 5.7, you're a normal person. If you're 5.7, 6.4, you're pre-diabetic. If you're over 6.4 and if you're 6.5 and up, now you're in diabetes. So that's everybody doctor will measure A1C. And it is a average 3 months average blood check for you. So you really cannot say, I don't eat anything, so let my blood sugar a bit lower so I can able to measure myself better. It won't work because it gives you a 3-month average. So basically, if you can really do it in 3 months, control everything, yes, your A1C will be better. But you have to continue to do this. If you don't continue to do that, go back up. Okay? So net result, A1C is a very accurate way to understand, are you a pre-diabetic, a diabetic, and what action you have to do. Okay? Now, why there is a pre-diabetic issue? Now, what happened is your cells become more resistant with the insulin. In other words, you remember, one of the problems you have is your LDL cholesterol damage. The B cells come out from the insulin that takes sugar to the cells. When the B cells damage, so more insulin coming out, it won't work. Usually this is called insulin resistant. Now also they might, because of that, your pancreas keep coming with more insulin, but on the other hand, you really no longer supply enough. So in that result, your sugar will continue to go up and go up and go up. And eventually your blood sugar will go up so high that you're reaching your A1C beyond 5.7, it'll go all the way to 6.4. That become a pre-diabetic level, right? So, and your sugar are not keep going back to the cell's fuels, because importantly, your sugar has to be, your blood sugar go to the cells, and the cell use the blood sugar as a fuel, like energy, right? So if you do not able to get that, we'll just continue work on, and net result eventually your blood sugar continue goes up. And when you measure you, then they know, wow, you are now become a pre-diabetic. Now, if nothing you will do, you don't do anything, your insulin is still not continue to work, eventually you will convert to a diabetes. Now, the sad part is this: once you convert it, you got to start getting medication. It will continue to go up and up and up. A lot of time, the insulin system becomes so strong that even though you take medication, it didn't really work. And that's why we found that drinking Lowsutea might would help you to improve that situation, increase the insulin sensitivity, take back sugar in the cells, the excess sugar would dump down on the urine. And that's why Lowsutea sometimes will help many people pre-diabetic state become also change back. Instead of going to diabetes, they stay in pre-diabetic stage or become a normal person. Now, there are two ways usually identify how you become a diabetic. One is called a fasting plasma glucose test. In other words, what they do is you don't eat anything after midnight with 8 hours fasting, and next day you will take a blood test to check. Most likely, they will do a A1C, HbA1c test, which will give you an average 3 months data to basically understand what their sugar is going to be. And majority of doctors will start to test that. Now, that is one of the very key indications, and which, matter of fact, in the worldwide, doctor will always check with your HbA1c. So net result, every time you go to see, you got to ask doctor, hey, what is my A1C? That will be a very good question to ask. And if you are A1C between 5.7 and 6.4, you are definitely a pre-diabetic. Anything over 6.4, you are becoming a diabetes. So now you have to have really concern. You have to very quickly convert back to the pre-diabetic state. Eventually go down to to 5.7 normal state. You can be done, but that actually do by your lifestyle change, your food change, diet change, and exercise, weight control. All that thing will work together to get back you to be either pre-diabetic stage or normal stage. Now, if you are pre-diabetic, some of the risks that you associate with, two major risks, and that is not good, either one of them. One is called heart disease. You know why? Remember, the cholesterol, LDL cholesterol goes up high, and it plug up your blood vessels with the sugar, and you become forming plaque everywhere. One of the places that form plaque, besides your brain area, you're also forming your heart. So many of the diabetic patients, the coronary artery will be all plugged up. And eventually, because the plaque was so much, you're going to get heart disease and eventually heart attack. If you heart attack, you might die. And that's really sad. Sad thing is stroke. You know where the blood going through, but there's already plaque on the vessels, and the blood cannot go through the back of the brain. It has lack of food, oxygen, and food, and the brain cell will die. And when you have that happen, you're going to have stroke. And if you have stroke, sadly, is you have tremendous disability come along, meaning that you might be cannot walk, cannot talk. All these things can come along, and really the cost of healthcare will be extremely high. So the major two risks will be so sad. You don't want to be in that boat. Is heart disease and stroke. So to control your sugar will help you to prevent the two major diseases. Now, you really have to think about other problems that if you have your blood sugar continue to be high as a diabetes. And I list the whole thing for you. One, you have a risk of stroke. You have also loss of memories, which is called dementia. Diabetic dementia is very common. You know, where you might have auntie and uncle keep asking the same question in 5 minutes of asking you, and then you say, man, it's so bothersome. You know, you keep asking the same old thing. But he doesn't know. He can't remember because, again, the blood going through a block at the back. He cannot read them, cannot remember, so he will not know that he asked that question. He keep asking you. I saw many people are like that, As a matter of fact, the new diabetic type 3 is called Alzheimer's disease. That's come from that. It's called, it's Alzheimer due to diabetes. And stroke, as I mentioned, is the important one. On top of that, you might be blind. You're going to start getting blurred. It's called diabetic glaucoma, cataract. That's very common. Heart disease we'll talk about. If your pancreas doesn't work, you have to not enough insulin. You have to inject insulin into you every day. And that will be a really humbug and costly issue. Plus, you have to inject every day. Imagine that. You don't want to be in that boat, right? Nerve damage, a lot of people don't know. Now, nerve damage is very problem because it affects the entire body nerve because of the just circulation plug. You can feel, so your lower extremity especially, you can feel. And a lot of people have no sexual function because they can't feel. Plus, your blood pressure will be always high and damage your blood pressure hardening. So net result will end up would be stroke with high blood pressure. And then if you have no pain feeling, so you might injure yourself, the circulation will be bad, and then the healing process become very poor. You might end up chop out your feet. One of the things that a lot of people don't realize, your diabetic will end up with dialysis. Wow, imagine that you have to go dialysis every 2 to 3 days per week to go to the hospital or do at home dialysis, CAPD. All that will be extra medical, and you have all kind of problem coming along. Plus, if you're pregnant, you could have diabetic, with gestating diabetic, which is also complicated a pregnancy. And afterwards, you can become a diabetes because of the pregnancy. Now, all that will be part of your potential because your blood sugar go up and affect all the vessel organ, is entire body systemic. So really, I don't want you to be in this problem. So let's work with the pre-diabetic. Don't get into serious diabetes. You will never see this kind of problem. So that's why I said, if you can able to control your 3 high, you most likely will be healthy and decrease many of the risks, okay? However, if you are pre-diabetic, usually you have no sign symptom because unfortunately, because you are pre-diabetic, you have no sign symptoms, so you will not have the motivation to do something, right? So but on the hand, they do have some of the people will start realizing they have some issue. One of the more common one is dark skin or dry skin, and their skin and the armpit become black, and the side of the neck. Also, the change of the eyes, which start getting blurred. It's called diabetic retinopathy. So all that can be exhibit, but majority of the people will not have this kind of symptom. That's why a lot of people will get themselves suddenly say, "Oh, I'm a pre-diabetic." The reason is they went to see the doctor, maybe do the other checkup or health annual check. They start seeing the A1C start moving up tremendously. Now, other sign also eventually it get more serious would be like increase of thirst, the frequent urination, increase of hunger, feel tired all the time. The vision loss is really going to be something already start more serious. Numbness and stinging to the feet and the hand. There are also frequent infection because the wound just doesn't heal. The sore will heal very slowly. And also, one of the more common things is suddenly you lose a lot of weight. And a lot of people say, wow, how come I suddenly lose weight? I must be doing good. But it's not necessary because lose a lot of weight could be due to the ongoing starting to change to diabetes. Certain kidney disease, your kidney function start falling down. And that's something that, again, in your normal check is really going to be find out that. Plus, as time goes on, your heart disease, that's even more serious. So you don't want to do all that come into this area. You want to make sure that you are continue to prevent yourself from pre-diabetic change to diabetes. So that's what I really want to do. Now, how do you do that though? One of the things is food. You gotta make sure you have control. You can easily do that, and changing your lifestyle can easily do that, but it takes effort. You have to do it, and you have to work on it. So what's that mean? First of all, when you have take high calorie food, for example, you do a lot of food with high calorie. Oh, wow, what's that mean? Well, high calorie food is mean, like for example, I eat a lot of food with a lot of high GI, carbs, mainly carbs. Where you need to actually do is your carbs should be at least 150 to 200 grams. That's it. Okay. Now, You might say, I don't know how to calculate my carbs. It's very simple because all packages now will tell you how much sugar in grams in there. So if you take 100 grams of cereal, you will see the number of gram it is in the package. So you can really look at that and say, wow, gee, I really cannot eat a lot of carbs, right? So first of all, you have to look at all the GI food, and I'll give you a chart later and take a picture. What is high GI, what's a medium GI, what a low GI, I will give you that. So, but on the other hand, if you know your low GI food, basically will give you a better health lifestyle to maintain basically a better blood sugar. Your carbs, carbohydrate also lower, so less carb to absorb. So your most likely your blood sugar will also go down. Your obesity will also go down. So very important to control your food on low carb, low GI food. So don't take a lot of high calorie, high GI. That's not good for you. Now, another important thing, as I mentioned, you have to read label, right? All the nutrition have label here, just like this one, okay? And the label will tell you how much carbohydrate, how much fat, how much sugar, how much protein. They all listed here. So you can choose the product which is low carb, low glycemic index food. That is something that you need to continue to practice. Don't just eat anything without looking at the label. And then also you can choose food that are high fiber, high protein, which is help you to full. If you have a lot of protein, it make you feel full or longer. You don't feel to eat all the time. That is important. Now, so what other? So telling the principle, reading the label, and choosing the right GI food. Okay, how to avoid, the so-called, food. Then what food should I avoid not to take? Okay, very simple. Basically, the sugary drink, in other words, the sugar soda like Coke, forget it, because that is 300 grams. That's the carb is very high in the sense that just a Coke. And on top of that, like anything with bubble tea, those kind of stuff, forget about sugar drink. Really, that is really hurt you. So just going to give you a story. One of my client who is an engineer, he's 40 something years old, but his eyes started getting blurry. He thought he had short sighted. But I said, no, you got to check your eyes. Then found out that he had already got diabetes eye, and whereby his sugar is always very high. The reason is every day he drink about 3 to 5 bubble tea, and that is very sugary. And he doesn't move much. He's overweight. He's obese. He's an engineer. He just sit and he doesn't do any exercise. So net result, that sugar drink really cost him tremendously with his eye. So we have to cut that off, and then eventually he lost basically one vision of the eye, one is still work. Okay, imagine that 40, number 50 years old, you lose some of the eyesight. That's terrible. Now, so you have to take refined carbs. You have to basically refined carb you need to avoid, okay, not to take, avoid. And for example, refined carbs like white bread, pasta, rice, that's all that actually can cause sugar can go up very, very fast. Fried food like French fries, very unhealthy fried food. And you can actually all that will have increased calorie, increase your weight. You don't want to do that. Also like cereals, a lot of people don't realize every day your cereal, and one bowl of cereal actually could have 69 grams of carbs. So you really need to look at the label. Don't buy the cereals with high carbs, high sugar, because that will definitely add up to hurt you, okay? Like processed snack, like chips, cookies, crackers, all those, again, there's high sugar, sodium, and also fats, which is unhealthy. Now, a lot of people say, oh, yogurt is good. Yes, yogurt is good. However, if you have flavored yogurt, a lot of yogurts actually have a lot of sugar in there, although there are fruits in there, but there are a lot of sugar. You have to check that. Plus, fatty meals, including bacon, sausage, red meat. So cut out of that. So because those will have a lot of high level of saturated fat, and also that will increase your heart disease also. You want to eliminate most of this stuff. So net result, how do you find out that? Read the label. That is always going to help you. Now, certainly you need to really, a lot of time to say, how do I really more mindfully to understand not to eat a certain food. Like, for example, starchy vegetable, potato, corn, peas. Those are, I know a lot of you have to eat some, but can you eat not lots of that? But on the other hand, eat more green vegetables, salad instead of potatoes, and certainly dry fruits is certainly appear to be healthy, but they are a lot of sugar. So try not to eat a lot of dry fruit, make more nuts, for example. And then fruits, you can able to help you. Good fruits are good, but don't get mangoes because a lot of sugar. But eat more apple, things like that will help you. Pears. So net result. Now, more important, forget about fruit juice because fruit juice can be extremely high in sugar, and on top of that, you don't have not much fiber in them. So eat the whole fruit is the best. Now, so really, you have a good alternative, healthy alternative to help you go for pre-diabetic. Now, fruits will be something like apple, berries, citrus fruit will help. It's good for you. Vegetable, leafy green vegetables such as like vegetable like romaine lettuce, for example, roots vegetable. Those are all good. Make your salads delicious. And whole grain, granola, brown rice, whole wheat bread, red rice is also very good. And certainly you have to get lean protein like chicken, fish, not to get really a lot of red meat because red meat is not going to help you either. Now, it's good to go on your whole food, like high fiber whole food. Like, for example, grain is also very good. Wheat is also very good. So whole food is always help you to lower your blood sugar, not to add sugar to you. So really, at the end of the day, the principle is get whole food, low sugar, low calorie item, but good nutrition with good vitamin, mineral. Those are very good food for you. Now, on the other hand, you said, wow, you tell me all the food, but I like snack though. At nighttime, I have to eat snack. What can I do? Well, they're a good snack for you. You notice there's a lot of here. You can have cucumber. You can have celery. Healthy snack can be really important with green healthy snack. You don't need to actually eat all the time with chips, cookies. Those are going to be tough for you. Now, people need to basically have craving, but importantly, you have to get some, like for example, raw vegetable hummus, fresh fruit, fruit salad, like for example, apple salad. You need to have low fat dairy product, yogurt, and cottage cheese. Now, add nuts. Almond nuts is extremely good. Walnuts, pumpkin seed, all those are good. I eat a lot of almonds. If I'm hungry at nighttime, I really want to eat something. Eat 10 pieces of almonds is good. Or could be a hard boiling egg sometime if you want to. Whole grain crackers is also good with some nut butter, but not in the sense of a lot of butter itself. So really have nut butter is also good. So you have a lot of choice, but make sure that you look at things that really are less fat, more vegetable, more green. Is actually as a good principle for you. Now, certainly, healthy dessert also can be like almond milk, like instead of regular fresh milk, but almond milk is also good. And you can put some nuts in there or get some homemade sherbet with fruits and low calories. Those are really good. The important getting fresh fruit. Berries are very good. Apples are very good. Greek yogurt is very good. If you really need some sweet, try dark chocolate. 70% dark chocolate is good. So net result, you have actually a lot of choice. You can go up the web and look at all the different, low carb dessert. They teach you how to make different low carb dessert. You have all kind of choice, but important is just low carb, low fat. Now, I also include today a bunch of things that for you to see. You can take a picture of this. Now, imagine if you eat a lot of rice, that's not good for you. Eat red rice or brown rice. That is much better. And if you have a lot of these pastries, that's not good. Mango is not good. Grape is not good. So it's good to get what apple, pears, all these are good stuff. Wheat bread, lean pork, fish, like for example, cod, salmon, those are good stuff. So eggs. So really at the end of the day, you can take this as the low index food and you try to get this low index food. Now, really at the end of the day, your diet, half of the plate are all what? Green vegetable, meaning that you have a leafy lettuce, you have celeries, whatever you have green, you put it there. On 1/4 of the plate will be all your lean meat and protein, like for example, lean chicken, lean pork, or fish. Best eat more fish because they have a lot of good nutrition value in fish, omega. All type of good fish, it'll be salmon, cod, those are all good stuff. And then a quarter of that will be your really your starch, could be whole grain, wheat, could be tofu, could be red rice, brown rice. Those are stuff that you can add together. So if you have your diet like this, most likely you will become very, very healthy. Your carbs will be well controlled. So, and at that day, you will, after doing dinner, you need to drink Lowsutea. We'll drink basically 2 cups of tea before and after. Excuse me. Why before? Because the first cup of Lowsutea you drink, it coat the stomach, so you have basically the sugar will not go to the gut. And then you drink a second tea while you're eating food. The it will increase the second cup of tea will also increase your insulin sensitivity, take the sugar into the cells. That will be wonderful. But if you have excess sugar, you know what? They will dump sugar, cholesterol, and salt out the urine. And that result of that, your 3 high will definitely come down, meaning your blood sugar, cholesterol, your blood pressure, and also help you detox. And you will find that after you drink Lowsutea, you become much more, void a lot more. So that will be definitely end up you get that result. Okay, now with that also you will lower your blood sugar, blood pressure, and also your bad cholesterol, and that you will always have. So in conclusion, the pre-diabetic, you want the key here is prevent you convert back to type 2 diabetes. And if you can prevent that, you must adjust your lifestyle change, which is going to be your diet, you got to exercise, your weight control. If you've done all that, the chances of you become a diabetes will be definitely much lower. But this will be mainly come from all the eating habit you have because you have no sign symptoms. So you really look at all the labels, all the things that you eat, make sure that it doesn't raise your blood sugar, and the carbs will be much lower. And also you have to limit the amount of sugar food intake, the low carb food, you should have more of that. And on top of that, you want to make sure that your low low fats, low red meat, more green vegetable. That would definitely help you have a lot of whole grain, non-starchy vegetable, healthy fat, all that. Basically, limit your sugar drink like soda. That would definitely help you to lower your blood sugar. And if you can able to change that, the chances for you to be successful to not become a type 2 diabetes is much higher. So in other words, you can control your pre-diabetic progression to diabetes. That will definitely and will help you become much more healthier person as we get older. And really from the diet, is really take one of the big part of it. But on the hand, you also need to take your exercise, your weight control, and sort of work with a doctor, your dietitian, to continue to help you to work toward to this better health strategy. So today, this is my webinar to show you why your diet is so important in your pre-diabetic, where it can prevent you from switching to diabetes, and you can able to change just on diet alone. So you still need the support by your exercise, weight control, and so net result, you can able to overall become changing a lifestyle. And definitely, I can assure you, when you start doing that, you find yourself much more healthier. You say, wow, you mean I can do this? Yes, you can do this. And let's start today. Just start changing your diet. Read the label and able to say, wow, my cereal is 60 grams of sugar every day I eat just the first bowl of cereal. So you can eliminate that, because it's with 60 grams. Each day you only have 150 grams to 200 grams of carbs you can take. So if you can already take 60 something grams, your breakfast just wipe it out, right? Or drink 2 cans of soda, you're gone too. So don't do that. Let's control and know what you eat, what you put on, and you use the exercise also. Lock it down. So I did 10,000 steps per day, and that will help you. Definitely can lower your carbs, lower your sugar, lower carb intake, lower your blood sugar, and eventually with that you will definitely lower your cholesterol and your salt. You lower your blood pressure. Your 3 high go down. You'll be much healthier. Okay, if they have no question, let's see. How do clients determine if the product has low or high glycemic index? Okay, now there's a question from Shirley. If you can able to look at that, this is the product will basically have low glycemic index, and this is the question you ask. And when you have that, basically it's very simple, because you can look up an apple, and in the website, you look at apple, what is the carb for apple, for example? And it's very simple. If you look at that, they say, oh, apple. If I eat an apple, my carbs is only basically, for example, my carb of apple is only about 14 grams. So I eat half, 7 grams. So very simple, using just your website, because you eat a lot of food you don't know. Then write down like what is the carb for the apple. You already know that's cost 14 grams of carbs for you. So if you eat that carb, 14 grams, the whole apple, if I eat half the apple, it's only 7 grams. So now you have another 130 something grams to steal for the rest of the day, because you try to put yourself as much as 150 grams. So that's what we're trying to do per day as a target. So it's very simple. I know there's a lot of different food, so you need to understand if you eat a certain food, what would be the carb. So easy to understand. Just look up that on our website. And as I said, apple is 14 grams, and you can go for strawberry, you can go for all the other stuff. So I hope that will answer you. Thank you very much, Shirley. I appreciate you asked the question. Okay, if there are no more questions, we will see you next week. We'll have another different topics, and hopefully that will be a wonderful weekend. And I thank you very much on your busy weekend can still join our webinar. And I hope that you will learn something and alert yourself. And I'm so happy to continue to give you webinar to give you better understanding. Thank you. You take care. Bye-bye.